So I think we can begin. It's 6:01. I want to start off by thanking everyone for joining us. I know we still have a number of people who are continuing to join us for the IMPD OPHS Town Hall. My name is Alexa Boylan. I'm the Chief Communications Officer here at the IMPD. Going to start with a few ground rules just to let you know what to expect. We're going to have a number of presentators, including IMPD and OPHS. During the presentation, which is going to last about 25 to 30 minutes, we encourage our residents to ask questions or provide comments in the chat. And then once the presentation is actually over, that's when we're going to go through and start answering those questions. Again, this is an opportunity for you, our residents, to ask questions of IMPD leadership, IMPD officers, and a number of other officials and partners like OPHS about the complex challenges that our unsheltered neighbors are facing. For now, I do want to keep it short and sweet because we have a lot to get to. I'm going to introduce Assistant Chief Michael Wally. Chief, you want to join us?
Alexa, thank you. First and foremost, I thank everyone out there for attending this meeting. Some may call it as simple as just logging on, but what it shows to us is that you are truly engaged and want to learn what we are doing behind scenes to make sure that all community members, no matter what is going on in their life, get the resources and their concerns addressed. I wanted to start off by thanking the people that made this possible. Obviously, our North District and South East District teams under the command of Commander Thomas and Commander Hicks, Major McLemore over Ops support, but also our partners with OPHS, Andrew Merkley, for helping us execute the mission of bringing valuable information to our community. Chief Bailey has been very clear what our priorities are. It's continue to drive down violent crime, recruiting and retention, officer safety and wellness, building bridges of trust and legitimacy within our community, technology, and our strategic plan. Part of building bridges of trust and legitimacy is certainly making sure that you, the community members, have access to information and, again, a peek into what we are doing with our community partners. Hopefully, you'll walk away from this meeting with a better understanding of how our partnerships work, some of the barriers that our unsheltered population navigate, resources at your disposal should you find someone in need, and how you can help. But most importantly, I want you to see the faces of the people that are part of the solution to helping those in need. And so I want to welcome our newly appointed major of the Operations Support Bureau, who is charged with specifically navigating some of the challenges of our unsheltered, but also our mental health members with our community that are having mental health issues or problems in their lives. So I'll turn it over to you, Major, and thank you.
Hello, thank you, Chief. I just want to thank everybody for being here tonight and giving IMPD and OPHS this time here to present this town hall on understanding the complex challenges for our unsheltered neighbors. So let's begin with our presentation. Let's start off with the definition for what homelessness is. So this definition is from the Department of Housing and Urban Development, which is also known as HUD. It resides in a place not meant for human habitation or resides in an emergency shelter or transitional housing. These photos here are from an active camp here in Indy. The one to the right is from a while back ago, but it's before a cleaning was done. Just yesterday, the one to the right, cleaning was done with a collaboration between IMPD and DPW. During this time, resources are always offered before, after, and during these cleanings. It should also be known that IMPD, the homeless unit, and other outreach providers do visit this camp on a regular basis. And who are our unsheltered neighbors? Each year, outreach partners led by the Coalition for Homelessness Intervention and Prevention, also known as CHIP, come together for one night to count the number of unsheltered neighbors for a snapshot of the population that night. This always takes place one night in January. This is known as the point in time count, or PIT as we call it. The annual PIT count is a census of sheltered and unsheltered individuals experiencing homelessness and provides critical information to better understand the homeless population here in Marion County. This is a requirement by HUD, and it helps to determine the amount of federal funding the city gets. And here are some homeless statistics. This data is from the Department of Housing and Urban Development. And I would also like to point out that here in Indy, we have seen a decrease in veteran homelessness due to an increase in federal funding and partners like Helping Veterans and Families, which is also known as HVAF. To better serve our residents, it's also important to recognize what causes homelessness. Sometimes, though, it is not clear-cut, and some of these root causes can and do overlap with one another. It should also be known that some things like addiction, substance abuse, domestic violence, and mental health can be a cause, but can also be the result of homelessness. Some barriers. You all might be asking why our unsheltered neighbors make a decision to stay on the streets and not go into shelter. There are barriers for entry for some people who are living on the streets. Our shelter system does not accept people with pets, and like many people, they do not want to part with their pets. Sometimes that's the only companion that they have. Also, many of our shelters are faith-based, and what our team has been told is that some of them do not want to engage in that. There are challenges like sexual orientation. There is also barriers for fathers with children or just families with children. We don't have a shelter right now that provides an option for fathers to be in the same shelter as their child or for families to go together. This causes them to split up, and some do not want to do that. It's also a challenge for families, for adults that have children with disabilities that are also over the age of 18. Here's an example. If a mother and her 19-year-old son with autism are looking for shelter, they would have to be split up. The son would have to go to the men's shelter, and the mother would have to go to the women's shelter. And sometimes families just aren't able to do that split. According to the Substance Abuse and Mental Health Service Administration, 21% of individuals experiencing homelessness reported having a serious mental illness, and 16% reported having a substance use disorder. What we have seen with our interactions with unsheltered neighbors is that some of them are struggling with addiction and various mental health challenges. Here's a little bit of information about the crimes that we sometimes see with our unsheltered population. And again, we're going to rely on what we have seen and what we have heard from our neighbors. Many of them have reported to us as being victims of crimes like theft and assault by other unsheltered neighbors. A little bit about our homeless unit. The unit has 4 full-time officers assigned to the unit. The officers in the unit develop relationships and see firsthand challenges from our homeless users and what they are facing. We try to work with them and providing them resources, connecting them to other city agencies and partners, and to help them to get a roof over their head. But sometimes it's just not that simple. It should also be known that during extreme weathers like cold and heat, and it does go out and do extra welfare checks on our neighbors out there. I feel it's also important for our community to know how we try to build that rapport and those relationships with our homeless neighbors. In order for us to build that rapport and that trust, we do things a little bit differently than the traditional IMPD officer. We wear khakis and a polo for a softer appearance, and we also do not ask a lot of questions when we first meet them. We'll start off with just a first name, and we'll begin to build that relationship and that trust. This is the way we build that rapport so that we can get them the resources that they need. Our ultimate goal is to help and not cause more problems. Here's a little bit about our resources that we have in the city. We do have a long list of resources, and not all of them are able to fit on here. There are many more, but we just want to thank a big thanks to all the invaluable service providers that are out there and the help that they are giving us. And then here is a list of our partners. This is also just a partial list, as we do have many more. As you can see, there are some other city agencies that we work with on here, like the Office of Public Health and Safety, Parks, and DPW, and some of our close outreach partners, like the Professional Blended Street Outreach Organization, with the Poor House, and Adult and Child, and Horizon House. I can't even list everyone, but I do need to acknowledge that all of our partners are amazing, and we're very thankful for them every day. As we always say, it does take a village, and we do it very well together. So thank you. But speaking of incredible partners, I would like now to introduce Andrew Merkley with the Office of Public Health and Safety.
Thanks, Tabby. Good evening, everybody. Again, my name is Andrew Merkley. I am the administrator for the Division of Homelessness and Eviction Prevention with the Office of Public Health and Safety, or OPHS. Our director is Romy Bernard Tucker, and my team consists of Hillary Ashavaka, who's our program coordinator over the homelessness programs that we have, and Andy Beck, who's our project manager over our eviction prevention work. The Office of Public Health and Safety aspires to enhance public awareness and education, leverage community partners and resources to ensure the highest level of health and safety for all of Marion County residents. And our mission is to equitably promote and protect health, safety, and well-being of individuals and communities through effective intervention, prevention, and partnership. And to that end, as we're talking about our homeless camps that exist here in the City County Council provided OPHS with the ability through city ordinance to close camps when necessary. And I think it's important to understand for everyone on the call how a camp is defined in city ordinance. A camp refers to a place on public property where homeless residents have established temporary accommodations of tents or other structures in which homeless residents are sleeping overnight or storing their property. And the ordinance directs OPHS to close camps when there's evidence of public health and safety concerns. And there on your screen, you'll see the code site for that, the ordinance that I'm referring to. But it is not OPHS's goal to go and close any and all camps that we identify throughout the city. And that's for a couple of reasons. One of the big ones is that when we close camps, it makes it more difficult for OPHS, IMPD, our partners, to work with and engage with our neighbors as they continue to move around and find new places to camp. Can you go back a slide, please? Thank you. And so what we try to do is to clean and maintain those camps as best as we can, and OPHS has funding to do that. It helps when we clean and maintain camps. It really removes some of the possibility for that public health challenge, and it solves for the neighbors that cannot or will not go into shelter by keeping them where they are. What those protections for the unsheltered, can we go back a slide? Thank you. What that city ordinance also does is it provides protections for our unsheltered neighbors in the event of a camp closure. And the very first thing that the ordinance talks about is it says no person should suffer unnecessarily or be subject to unfair discrimination or arbitrary treatment based on his or her homeless status. And it outlines 4 specific points about how we need to ensure that we protect our unsheltered neighbors in the event of a camp closure. So when we do decide that a camp needs to be closed, we have to ensure timely and appropriate notice of that closure is given. And we work with the Blueprint Council and the Indianapolis Continuum of Care in order to make sure that that notice gets broadly distributed. We provide storage of personal belongings for up to 60 days if someone wants that. And we coordinate with other service providers to ensure that there is adequate shelter and housing offered to the neighbors in the event of a displacement. We really do work closely with IMPD and the professional industry outreach teams when we do have to close a camp. And OPHS is only authorized to close a camp when it is in the local public right-of-way. But we work closely again with IMPD in the event that there is a camp on private property. There are options to trespass those individuals so that they can be removed from private property. And the parks ordinance does not allow for any camping in public parks. And so we work closely with the parks department as well. Anytime there are issues on state property or railroad property, we have partnerships with the state and the railroads to address those camps as well. And because it is not OPHS's mission to close camps, we understand that there's additional resources that need to be provided to our neighbors who are living outside. And so we've invested heavily in things like Aspire's mobile clinic to take healthcare resources directly to our neighbors. Restroom and hand washing facilities have been purchased and placed in very strategic locations where we know that our neighbors are frequenting, so that they have access to clean hygiene. And I think what's really important is that the city has invested in behavioral health teams to address behavioral health crises when they happen. And one of those, the most recent of those, is the clinician-led community response team. And that is exactly what it sounds like. It is a clinician-based team without officers that goes out and can respond to mental health crises whenever there is no violence or weaponry involved. In the event that there is violence or weaponry, then we would dispatch our mobile crisis assistance teams, which involves both a clinician and an officer. Another really great tool in our toolbox here locally is the Assessment and Intervention Center, or the AIC for short. The AIC provides mental health and addiction assessments to individuals who are experiencing substance use disorders or mental health crises. And it provides referrals to the appropriate treatment and community services outside of the Assessment and Intervention Center. It's not a shelter, but it is a 24/7 facility where folks can stay overnight and can stabilize so that we can get them to the most appropriate resources. The real goal with the AIC is to divert nonviolent and low-level offenders from entering our criminal justice system. And for those of you who may not be aware, it is located on our criminal justice campus. And if you there's contact information there on the screen if you'd like to contact them, or if you ever come across someone who may need their services. The city's response to homelessness is really about solving for it. And we do that through a housing first approach. And so there's some notable developments that are occurring here in 2024 that I wanted to mention. Something that many of you may have heard of in the news or through the state legislature is the Housing Hub, or the Low Barrier Shelter. This is a facility with multiple parts that's not just a shelter, but it's really a place for our homeless neighbors to access resources and housing navigation. And we hope to break ground on that facility late in 2024. Another way that we're addressing homelessness is through master leased units. And those were announced today. 53 units are coming online in April. And I'll talk more about those in detail here on the next slide. But we hope to have 200 of those units available over the next 5 years. And finally, affordable housing development. We all know that affordable housing is difficult to come by since the pandemic. And specifically, permanent supportive housing is a type of housing that's really effective in helping to ensure that our homeless neighbors can be successful whenever they do find that housing. And so we have 88 permanent supportive housing units coming online in 2024. Finally, OPHS in the city, we'd like to prevent people from ever becoming homeless in the first place. And one way that we're doing that is through eviction prevention programs like the Tenant Advocacy Project and the Tenant Legal Assistance Project. These projects provide legal assistance to tenants who might be facing eviction or who have habitability concerns in their apartment units. And this is, we've placed attorneys and legal teams in all 9 townships here in Marion County. So what are the next steps? Well, like I said on the previous slide, we announced today those 53 units of additional supportive housing units. And what's critical about those is that this will be the first time in the city that we can offer someone who's living on the street the opportunity to immediately move into an apartment unit where they will be surrounded by those supportive services, and they can stabilize and work with their service provider while they identify that permanent solution that they can move into at a later time. This reduces the amount of time that our neighbors have to spend unsheltered, and it allows, like I said, it allows that stabilization that's necessary for them to be successful in their housing journey. Lastly, the Indianapolis Department of Metropolitan Development also today released a request for information from landlords and service providers that will help to increase that supply of permanent supportive units through that master leasing model that'll get us to those 200 units that we want to see over the next 5 years. So kind of coming full circle here, if you have any concerns about a camp or homelessness in general or eviction prevention, please contact the Mayor's Action Center. The number is there on your screen. And if you have any public safety concerns about camps, you can contact the IMPD homeless unit through their email that's listed on that screen. And we will all work together to coordinate responses for those concerns that you may have. And we'll wrap it up with any questions that you all may have.
Thank you, Andrew. We really appreciate all that information. I'm going to start up at the top, and I'm just going to go from the top of this chat to the bottom because there's been a number of questions and comments. So I'm going to try to go through. First and foremost, I know a number of you have asked for the presentation, which we're absolutely happy to send out. So I've got all of your email addresses so far, everyone that sent it in the chat. But if you're interested in having the PowerPoint sent to you, just send your email in the chat and I'll make sure that I get it to you within a day or two. So just going down the chat right now, let me just see where the first question was. So one of the questions is, and perhaps Andrew or Major, you can answer this. It's why aren't you or why are you working with these campers on finding resources and on finding housing? Andrew, can you speak a little bit to that about our efforts to once either IMPD or once OPHS responds to a camp, what resources or programs they offer our unsheltered neighbors?
Absolutely. We are working with the neighbors in these camps to get them the resources that they need to either access shelter or to start on their journey toward housing. And the way we do that is through that collaboration with the homeless unit, the professional blended street outreach teams, and continued engagement with those individuals. Because the thing is, not everybody is ready to go into housing the first time we engage with them, right? So we need to engage on multiple times, and sometimes it can take months or years before someone decides that they're ready to go into shelter or into housing.
Thank you, Andrew. Next question, asking about some of these crime stats and them being connected to camps. I don't know if that's something that we track specific to camps. Tabby, is that something you can address for us?
That's not something that we actually track or can track. Many times that with a camping in the neighborhood or close to a neighborhood, people just may assume or see because they have the foot traffic coming from that camp that it may be our homeless neighbors that are committing those crimes, but we don't have a way of tracking that.
All right, next question, Tabby, or if Chief Wally, you want to speak on this. The question is why anytime we see or we have a large event in town, why do our unsheltered neighbors seem to leave that area? Tabby, is that something you could speak about?
Absolutely. I know that many think that IMPD move our homeless out of the area because of these big events, but that's completely false. Many of our unsheltered neighbors don't want to be around those big crowds. With the rapport that we have with them, we usually go out before events and let them know that, hey, there's going to be this big event in town. And they choose to leave the area just because, like I said, they don't want to be in those big crowds. Many of them just want to be left alone. So they actually move on their own.
Thank you, ma'am. Next question's from Terry. Andrew, I'm going to ask if you can answer this one. What if somebody won't go to the AIC? How do we manage that, or how do we work around that?
Yeah, we cannot force anyone to go to the AIC. What I think, what I know is the best solution in those situations is to continue to offer them these other forms of engagement. So, you know, if someone's experiencing the substance use or mental health crisis, we want to call 911. We want to make sure that the 911 operators know exactly what's going on with that individual so that they can dispatch the correct team, whether that's that clinician team that I mentioned, or if that's the MCAT team, so that we can engage in that way. You know, I think addiction and mental health challenges, they're difficult to solve for, and oftentimes it's difficult to get our neighbors to understand that they need help that the AIC can offer. But we have to continue to engage with Tabby's team and with professional blended street outreach teams so that we can make sure that they get those resources.
Speaking of the AIC, and Andrew, if you don't know this off the top of your mind, we could certainly follow up. But do we know how many beds they have now? Somebody's asking that.
Yeah, I believe there's 60 beds now.
Next question, and I don't know if we're going to have necessarily an answer for this, and maybe I don't know if IMPD can answer this. It's, you know, somebody asking if you could remodel some of the downtown buildings and house the homeless. Obviously, Andrew was talking a little bit more about this low barrier shelter. Do you want to take that and again just talk about
Sure.
where things stand? And I understand there's progress that's being made, and you hope to break ground. Is it this fall?
Yeah, that's the hope for the low barrier housing hub. There's really there are not vacant buildings that the city owns that we could do that with. But you know, the master lease units that were announced today, that's a great example of a public-private partnership where we actually did remodel that building, and we provided funding. IU Health provided funding to that effort to remodel that building and be able to house folks who were previously unsheltered directly into apartment units. And so we are thinking outside the box in various ways that we can address our unsheltered neighbors' needs.
Sure. Next question is in regards to resources being available for housing agencies whose focus is on residents with substance abuse issues, and that they're still continuing to have crime on properties. Maybe one of the commanders can talk about this if they're available to discuss what IMPD does and what support we can give if they're available. If not, maybe Assistant Chief Wally can chime in.
No, this Commander Hicks with Southeast. I'm happy to answer it, Alexa. Yeah, I mean, we addressed a lot of homeless issues, and I wanted to point that out that Major McLemore and her crew do a really, really great job, but there's only a handful of them. So we call upon them as often as we can, but each district has their own community relations unit, and I'll speak for my unit and Sergeant Gard and his crew. They spend an inordinate amount of time dealing with issues surrounding our homeless population. We get a lot of calls from neighbors and businesses just wanting answers to what we can do to help move folks along or how we can help them get housing and that type of thing. So we do quite a bit in that regard. And even our beat cops every day are out checking on our homeless population. Most of them know them well. and come in contact with them quite frequently. And they do a really good job of trying to help those folks as much as possible. But like Major McLemore pointed out before, sometimes they're kind of skittish of law enforcement. They're skittish of getting help, and they don't want to be around people. They kind of want to be left alone. So that poses challenges to us as well when we're trying to help them. And, we don't want to get into where we're just moving people from one camp to another, because that really doesn't solve the issue. So any additional housing that we can provide and other resources. I know that Southeast Community Services on our district provides resources, and they do job training and all sorts of things like that. So any of those types of programs that are developed or continued only serves us all well. I hope that answered most of what you're wanting, but if somebody's got a specific question, I'm happy to answer it from a district standpoint.
Sir. Next question is in regards to the clinician calls. I guess this is talking about the clinician-led program. Andrew, so I'll ask you this. Are there any studies yet, or is there going to be anything published about how successful it's been? My understanding, it's still very new. I don't know. Do we have data on that yet?
It is very new. And I know that the Deputy Director of the Division of Behavioral Health in our office is working to collect that data. So I think maybe the best thing to do here, Alexa, is take that question down, and we can get back to the group with that information.
Sure, of course. Somebody else is asking how to apply to become a nonprofit partner. Is that something, Andrew or Major, you can talk about?
Well, sorry, Major, do you want to take that, or do you want me to take it?
Feel free, Andrew, go ahead.
Okay. Well, I guess my first question is, are you saying that you're already a nonprofit and then you'd like to be partnered with the professional blended street outreach teams, or are you asking how do you become a nonprofit that serves this community?
I think that's totally fair. I don't think we have that information yet, but I think we would be open to working with anybody who's willing to make a difference and help our unsheltered neighbors out. Is that fair to say?
It is. And let me just say this real quick. If you are a nonprofit who serves this community and you want to be a part of the professional blended street outreach teams, you can discuss that with the Coalition for Homelessness Intervention and Prevention. And there's a way for you to get signed up to be part of that outreach team.
Thank you, sir. Just going through, I'm seeing all these emails, so I promise I will follow up with all of you in the next few days with this presentation. Terry is saying that his son, who's 28, has been homeless for 14 years. He has some mental health challenges and nobody will reach out to him. So maybe we could connect with Terry after this. Terry, I think you had put your email in the chat, but I know either Major or Andrew would love to connect with you after to see if we could reach out to your son and see if he'd be willing to have a conversation with us.
Yes, and I would just say, Alexa, that's not uncommon for us to have family members to reach out to us, especially with them their children being homeless. Sometimes they don't know how to contact them, or they're just trying to make contact with them to make sure that they're okay. So we actually have several family members that reach out for us to help. So we'll be happy to connect with Terry.
Another thing you two had mentioned when we were just preparing this presentation that I found really interesting was even if you reach out and offer them resources, it doesn't mean that somebody is necessarily ready to take them. Major, can you talk a little bit about that and what you've seen in your experience?
Yes, we see that actually quite a bit. Just, there's individuals out there that just don't want to quite conform to society's normals, and they just want to be left alone. We've had some camps that we actually had one individual that was homeless for, I believe 20 plus years. So before I even took over with the unit, but because of development and everything, he actually had to move, and we actually got him into housing. But I mean, all the outreach partners that we worked with, I mean, it took a lot of work and a lot of efforts. But after like almost 16 to 20 years. That's how long it took for them groups to be working with him to get him into housing.
Ryan's asking, and maybe this is again something for you, Andrew, just being open to working with more nonprofit developers to build temporary housing. I know that's not necessarily always within OPHS's wheelhouse, but can you just talk a little bit about that from your perspective and just being open and willing?
Sure. You know, our focus at the city right now is again on housing first and that permanent solution for homelessness. And so that's why we're really focused on the brick and mortar and developing more affordable housing and solutions that provide autonomy and privacy for our neighbors, because we have seen and we know that that is the real solution. Congregate shelters, temporary shelters, those aren't real solutions. We need to be able to get somebody into their own home. And then once they stabilize in their own home, that's when we can get them all of the other supportive services that they'll need to be successful.
Thank you, sir. Next question is, who can I contact if I would like to subcontract or partner with somebody? Is that something that we would have, or perhaps we can give contact information in the chat if we need to follow up with them, or if they would need to reach out to us? I think that would be beneficial if that works. Okay, let's see. Jim is asking about that low barrier shelter. So Andrew, I'll direct this to you. What's the projected completion date, and is that being developed by another agency?
So assuming that we are able to break ground in the fall of this year, we expect an 18 to 24 month construction window, which would be opening the facility sometime in 2026. Obviously that would, you know, we would have to have all of our ducks in a row to make that happen on that timeline, and we hope to do that. What was the second part of that question?
Or is it being developed by another agency?
This is a partnership with the city and Ardor, who will ultimately be, you know, leading that effort. Ardor Housing Corporation, and they're a nonprofit entity here in the city that really focuses on building affordable housing. And so they're taking lead on that, but it is a partnership between the city and Ardor.
Next question's coming from Lisa. She's asking how the average citizen can help. Major, do you want to take this one?
Yes, I'd love to. Lisa, the average citizen could help by actually, if you have any donations, like donated items, or if you want to volunteer to pack things like within your community, like food packets and things like that, and then give them to a professional organization. You know, we have the Poor House, Horizon House, Adult and Child, Wheelers. I mean, those just are just some of the few that are close and local. But the best way to help is by donating to those professional organizations and not actually going out on your own to hand out. We strongly discourage handing out personally, just because that creates a lot of other issues. It creates issues like with our homeless neighbors, if they get items that they don't want or they don't need, and there's not a trash can nearby, or sometimes even if there is a trash can nearby, they just throw that on the ground, and then that becomes somebody else's responsibility to clean up. And then it also gives a bad rap for our homeless neighbors that are out there. So we always encourage just to donate to those professional outreaches. And you can always email the IMPD homeless unit, and we're happy to point you in the right direction for that too.
Happy, if you don't mind, also putting that email in the chat and your contact information. I know a number of people would want it. Dan is asking, is the IMPD homeless unit tied in with the veteran service, such as HVAF? We actually were talking about this earlier. Can you talk a little bit about what our relationship is with them?
So we do work with HVAF. They're actually part of our PBSO, so we work with them with that. I believe they also have a partnership with North District Community Relations too. So HVAF's always reaching out to us to try to help our veterans that are out there. And then if we come across a veteran, if we contact HVAF, I mean, they have those amazing resources and they're able to get that veteran off the street usually that night.
Makes sense. Johnny's asking, next question is about what the housing process is. So once an individual agrees to move forward with housing, what does that look like? Andrew, can you walk us through that if you don't mind?
Sure. This is going to be a complicated response, and I'm going to try to make it as streamlined as possible. So there is a process that the Professional Blended Street Outreach Team and others go through where they assess individuals who are homeless, and they assign all of our neighbors a score based on their the chronicity of their homelessness, how long they've been homeless, what other co-occurring factors may be contributing to their homelessness. And that score, the higher the score, the more likely you are to be housed, because we don't have an endless supply of affordable housing, right? So we have to go through this system that was created by the Continuum of Care, and once we've identified those individuals and which programming they might fit into, whether it be a housing voucher through IHA or permanent supportive housing funding that maybe Horizon House has, we'll offer that to the individuals highest on the list who fit those programmatic the program that or agency may have, and then we offer it, and the teams start working on the paperwork and the identification needs and everything that individual would need to be successful in their long-term housing strategy. So that's a really I think watered down way of giving you that information. Just know that it's kind of complicated, but there's a full system in place that was put together by people probably much smarter than me. But yeah, if you have additional questions, we can always get you directed to the right folks.
And while I'm thinking about it, if you two don't mind, do you mind just putting your emails, and Tabby, if you don't mind putting the IMPD homeless units email in the chat, or we could do that after to make sure everyone has it. I know there's a number of questions, so I want to keep moving through to be respectful of everyone's time. Thomas is asking, he's asking if we have any pamphlets or anything that we could give out to neighbors when I interact with them. Major, I don't know if we have anything from IMPD. I'm sure we do somewhere. Is there anything that comes to mind?
So we actually have our MCAT brochure, which is our Mobile Crisis Assistance Team. So that we have that we could hand out. And then also like the AIC has actually like little business cards that have all of their information on it that are able to be handed out. And also back to the homeless unit, we are also listed on that brochure too for the MCAT team. So it's, yeah, we have those that we can hand out.
And again,
Tabby,
we'll make sure that we put your email addresses at this on the chat. That way, if somebody has a specific question like that, we can make sure that we follow up with you.
Absolutely.
I would also mention the Handbook of Help, which is CHIP puts that together every year. There's a virtual version on CHIP's website, and there is also a hard copy that CHIP probably has. I know they have them for distribution. One other thing that OPHS is working on with IMPD is a partnership with Motorola to create an app. And that app would have a lot of the information that's in the Handbook of Help, but that app would be accessible by anybody in the city, whether they're homeless or not. And it would really provide real-time information about the various resources that are out there.
Perfect. The next question is about legislation that's being drafted. I don't know if Chief Bailey is on here, and perhaps this is something he can speak to, or if Assistant Chief Wally can speak to, if there's any legislation being drafted. I don't know if that's something that IMPD or OPHS would be involved in, but correct me if I'm wrong. So feel free to jump in if there's anything you want to add on that.
I would say I would need to know what you mean by legislation and what context.
Sure.
There was legislation that was drafted through the task force report. There was a homeless task force report, and it suggested that the state legislature provide various kinds of funding for construction of a low barrier shelter, and it allowed the city to create an economic enhancement district in the downtown core that would collect funds that could then be used for homeless services and for the operations of a low barrier shelter. So that economic enhancement district is available to us, and the city county council will need to do some things on their end to make that economic enhancement district active. That'll happen this year. And then the funding for the low barrier shelter, the city of Indianapolis, we plan to apply for that funding in order to help with the construction costs of the housing hub.
Thank you, sir. I appreciate it. Somebody else is now asking about how homeless are prosecuted. We're not going to speak about the prosecution, but Tabby, can you speak a little bit? I know you presented on it about crimes that our unsheltered neighbors face or go through. Can you talk a little bit about your experience about that?
So I will say that with some of our homeless neighbors, with them having like maybe outstanding warrants, things like that, it does prevent them from getting into that housing. So we actually work with the prosecutor's quality of life unit and with the jails. With the quality of life unit, we're able to work through some of those court issues and some of those pending cases to try to get them helped where they can get into housing. So I'd say going back to our collaboration and our partnerships, that we're able to help with some of those cases just through those.
Okay, and next question is coming from our friend Emily. She said in the past she's seen cities that have actually taken possession of buildings where taxes are owed and then I guess renovated them or now use them for housing units. Andrew, can you talk to us if this is something that Indy could do?
I think anything is possible, but that is not something that we've considered here locally. We've really been relying on partnerships like with Ardor to rehabilitate the location downtown where those 53 units of permanent supportive housing are coming online in April. I'm not sure that there are a lot of those types of buildings available to us that we would be able to do something like that. But I think that's a question maybe for a different agency in the city.
Yeah, and I think a lot of these questions, we do want to be transparent. We're doing our best to answer them, but some of them are not within IMPD's and OPHS's purview. So I do think that's important to remember, and I'm trying to get through all of them. Somebody's asking about statistics and how do we support them. Can you all talk about CHIP's point in time count in that report that I did send earlier in the chat? A lot of the stats, correct me if I'm wrong, a lot of the stats that we have came from that.
I would just say that, yeah, a lot of our stats do come from that. There's the questions kind of change a little bit every year when outreach providers see like there's other things that we need to be tracking. There's still a lot of the same questions, like race, how long have you been homeless, things like that. But yeah, a lot of our stat tracking is through that point in time count.
Could I add to that, Major?
Of course.
That point in time count is a one night count in January. And so while it is it helps provide some understanding about our unsheltered neighbors, it doesn't really always tell us the entire picture. And so if you really want to see how we're doing with housing individuals, who is homeless in our community, that data is collected by and held by the Coalition for Homelessness Intervention and Prevention, and it's available on the Continuum of Care's website. So you can see how we're doing, and it's updated pretty regularly. So that would be my suggestion if you want to know more about what the city is doing.
Perfect. Next question, again, coming to you, Andrew. Somebody's asking, why can't we just find an unsheltered neighbor, give them a job, which gives them more stability in life? Is that something that Indy can do? From my understanding, from the conversations we've had, it's not always that simple. Can you talk to me about just the resources that we offer our unsheltered neighbors? And again, this is not something that we could force upon them if they don't want to follow through, right?
Yeah, that's right. I mean, it isn't that simple, but we do have DPW and OPHS have a partnership with a nonprofit called Keys to Work, and they do hire some of our unsheltered neighbors and get them into the workforce. That program started, I believe, back in 2018 or so. And so we get them into that program, and a lot of them are really successful at becoming full-time employees with DPW or with Keep Indianapolis Beautiful. It's a litter cleanup program, and while they're in that program, they might work with the poorhouse on their housing needs. And so, there are things like that we can offer, but we cannot force someone to go to work.
You. I am reading the comments, and I'm seeing a lot of you respond that you want this included in some of the task force meeting or crime watch meetings. So we'll make sure to pass that along to some of the community relations officers. The goal of this town hall, we wanted to do it virtual, first of all, just to make sure that a lot of people could attend. Sometimes in-person meetings just don't get the attendance that we would like. And we know a lot of people are busy during the week, especially during the 6 to 8 o'clock hour. But we certainly will keep that in mind as we organize future meetings. Okay, let's see. Ryan is saying, anyone interested in volunteering their time, please email him. John is asking, can we create policy? I'm sorry, John, I'm not exactly understanding that question. So can we create policy that actually conditions some of the benefits that are required to help? Sorry, I'm not understanding that.
I think I understand the question.
Yeah, okay, go ahead.
So if I'm understanding the question correctly, it's it sounds like, can we force or require individuals to participate in certain types of engagement so that they can become housed? And again, that's really not best practice. Best practice around the country, around the world, is housing first. So the main focus should be to get people into housing, into shelter, and then surround them with resources so that they can choose what is going to be most effective for them to maintain housing and to become employed.
Thank you, sir. I appreciate it. I do want to be aware of everyone's time, and I would continue to go longer if we could, but I did just get the alert that we have 5 minutes left before this Teams meeting shuts down. So I'm going to try to get through as many questions as we can. David is asking, how can churches within 5 miles of downtown help with feeding our neighbors? Major, do you want to address this? Because I know there have been some people that have really good intentions and come to the downtown area looking to give out food and clothing, but sometimes it goes awry. Can you talk about that?
I would actually recommend getting on OPHS's website, because we actually have a charitable donation site that is down at 900 East Kentucky Avenue. And that would actually be a good site for them to go to hand out that food. But again, going through the OPHS's website so that they can actually get signed up and permitting and everything. And Andrew might be able to speak just a little bit more on that.
Yeah. That ordinance that I talked about earlier, that very comprehensive homeless ordinance, it authorized OPHS to establish safe charitable distribution sites in and around the city. Right now we have one at 955 Kentucky Avenue, like Major said, And there are restroom facilities and hand washing stations there, as well as lighting and parking so that you can distribute food and other items to our neighbors. What I would be cautious of is Marion County Health Code requires that you, if you're going to distribute food to our neighbors, if the food is something that is needs to be at a certain temperature, you have to make that food in an industrial kitchen that is licensed by the Marion County Health Department. And then it has to be kept at that temperature while it's being transported and distributed to our neighbors. The easiest thing to do is to not do that. It's to get pre-packaged food and distribute that to our neighbors and pre-packaged. So you go to Walmart or Sam's Club, you buy a big box of those pre-packaged chips or sandwiches, and you can give those out, and you're not subject to those health standards that the health department has. We collaborate closely with the health department. And so if you ever want to distribute at that site or any other public right-of-way site in the city, you can always go on our website, let us know that you're going to do it, and we'll make sure to get you connected with various resources like Aspire's mobile clinic or the professional blended street outreach teams.
Perfect. Thank you all. I did put, by the way, both Andrew's and Major's email at the bottom of the chat. I'm just going through some of these questions. I know a lot of these are comments, and I'm sorry I can't read them just because of time constraints. But it does seem like there's a lot of good connections between some of our residents and some of our partners being made. Let's see. Some people are asking about housing them in the old jail, it seems like.
Yeah,
Andrew, you said something.
I think the easiest answer there is that the jails have been sold. Their plans to be converted into apartments and other uses, and so that's not an option. And then the women's, I saw the question about the women's prison. That facility is owned by the state of Indiana, and we did try to engage them about that location. Unfortunately, they weren't interested in doing much with that site as it pertains to our homeless neighbors.
Thank you. Well, I know we are almost out of time, so I do want to say thank you to everybody that did join us tonight. A lot of good comments, a lot of questions that obviously we could not even get to all of them. So we're going to have to hold another one of these potentially in person. And again, those emails are in the chat if you have any other questions. We do appreciate everyone being here. And as I mentioned earlier, I will certainly send this PowerPoint to you in the coming days. Anything else that I missed all? Anything else you would like to add before Teams kicks us off?
I just want to thank everybody for showing how important this issue is to everybody in the community and getting on here tonight.
Great.
Agreed.
Thank you all. We appreciate it so much.